Hi, I'm Liz Cortez with Business Trends TV, and today we are interviewing Dr. Geller from Complete Family Vision Care in San Diego. So,
Hey,
hi, Dr.
Joan.
Geller.
Hey, Liz, how are you today?
Excellent. Thanks for being on our interview today. So, I know that you graduated from SUNY in Albany with a bachelor's in biology, and you went to college for optometry. And I am excited to interview you. I know you also have experience working with lots of students and giving them resources through the two websites that you founded online, to give them resources and have coaches and people to give them feedback on how to become an great optometrist like yourself. So I'm definitely excited to talk about holistic eye care. So what is that, Dr. Geller?
Sure. So basically, the definition of holistic is really taking into account the treatment of the whole person, taking into account social factors rather than just, the symptoms they're having and issues like that. And really the other side of it is naturopathic, medicine and practicing through prevention, through, really looking at optimal health and using alternative methods other than pharmaceuticals and drugs and things like that to help someone out. And a lot of times, those are more of a long-term strategy. It takes a little bit more of an effort from the patient, and it's not really your magic pill remedy per se. But you'd be surprised how fast you get results if you really stick to a certain type of treatment. A lot of times, really, you're also looking at the psyche and the way someone wants to be treated and the way they want to be healed. And when it comes to eye care, it's very, very interesting. A lot of eye diseases are related to systemic disease. And so treating the systemic disease really inherently helps out the eye problems.
Oh, that is excellent. Thanks for sharing that with us. To check out the eyes, or maybe other things going on with the body. So when going online and looking for someone that provides holistic eye care, what advice would you give to the person that's watching this video right now?
Sure. We don't really, as optometrists, we don't truly classify ourselves as specialists in any area. And so it's difficult to find a database where you can say, I want to find a holistic eye care practitioner. And you can get, an optometrist can get their certification in one of those areas, but it'll be hard to specifically find an optometrist in that area. Now, of course, you could look at, there's a few societies, the Naturopathic Physicians, basically their society. There's another one, the American Holistic Medical Association. They've got doctor locators, but really you'll find more of a primary care doctor or some alternative therapy, and that can at least get you in the right direction. What I would say is really you need to do some digging. So first off, use Google to find someone in your area, look at their website, see what they're talking about. Perhaps they have a blog where they're talking about some of those areas. Pick up the phone and call them and let them know your interests and see what they say. A lot of times they may not advertise, but because the doctor personally practices that, they can really offer lots of advice. So I think it's an emerging area, lots of research. For example, the age-related eye disease study is a very long-going study that has shown us a lot about nutrition and eye health. And so you're beginning to see more and more eye doctors getting into that area and really forming a niche for themselves. For me, it came out of passion and doing it for myself, and that's what really helps me translate it to my patients. So it's very unique, and I would say it might be difficult to find one. Contact me. I'd love to help you find one.
Oh, great segue into our next section. I know that you at Complete Family Vision Care, you do provide this holistic or naturopathic eye care. And so why don't you tell us about the experience that someone has when they come and see you or Dr. White over at
Sure. So basically, for me personally, there's not a day that goes by where I'm not reading some article or listening to a podcast or an interview or doing some sort of research in really where this field is going. And I'm truly, for myself and my family, dedicated to making sure that we stay healthy through really, the best means possible, and that's preventative care. With the right food, exercise, and other little hacks here and there to help you. And so I brought that into the eye care practice. I don't have a certification after my name for that, but I have a very unique perspective on it because the passion really brings forth that. So Complete Family Vision Care, Dr. White has really created that practice. It's a phenomenal practice. He's been in practice about 28 years really good friend of mine. I practice side by side with him Wednesday, Thursday, and Fridays at the current moment. But you know, 2012 National Eye Care Practice of the Year, truly a phenomenal practice. But we're really starting to look at preventative care and looking at eyes in that way. So we've got a few, you know, interesting pieces of equipment that help us with that. A lot of them are screening tests, so you know, non-invasive screening tests. So I'll name a few just to start. You've got your retinal camera, which takes an undilated photo of the eye, looking at diabetes, high blood pressure, things like that. Then you've got your OCT, optical coherence tomography. You're looking for very, very, you know, small changes in the eye on a very subclinical level. And then one of the really, you know, those two are mainstay diagnostic equipment in eye care. So that's not truly holistic or naturopathic in any sense. But really the main one is our ClearPath DS120. That takes a non-invasive scan of the eye and basically looks at glycosylated end products of glucose, which in other words are sugars in a way that get stuck to the intraocular lens of the eye. You're able to measure that and predict about 5 years out if someone's likely to become a diabetic. That's where the conversation starts at that. Even if someone has no signs of diabetes, we are now beginning to educate on what diet should be enacted in order to not only prevent diabetes, but other, you know, major leading causes of death in the long run. Also, if it's younger people, we start going to maximum performance. You know, maximum performance. How can you feel your best? How can you do your best and succeed your best? And that's where it really, you know, becomes interesting. A few more things. You can really break down vision into a few different things, and you've got your refractive diagnoses, which is how are you seeing? Is the vision clear? Then you've got your binocular diagnoses, which is how do the eyes work together as a team, right? And then the last is kind of the eye health to really package it up. When it comes to refractive, people always don't always need glasses. Sometimes people can be too quick to prescribe glasses when really there's something hidden under there. They need to really change the way their eyes are functioning, how they're using their eyes. That's a very, I would say, holistic way of looking at it. You're looking at the person's lifestyle, where they're sitting, what distance they're sitting at, what their job is like, and really prescribing for that lifestyle situation. And now a lot of doctors do that, but it's until you really get into the conversation that it begins to really strike a chord with them. When you come to the binocular vision-related things, many kids are diagnosed with ADHD and all sorts of attention problems when really they just can't use their eyes. It's like they're walking around all day carrying a ton of bricks, and their eyes are doing way too much work. And really you need to rehabilitate that system to have them doing better in school and things like that. And so once again, it's a very holistic way of looking at it. Sometimes kids even have an eye turn or strabismus, and that's called strabismus when the eyes turn in or out. And a lot of times when they're young, you can remedy that through vision therapy instead of doing surgery. Now, not one is always better than the other, but personally I lean towards vision therapy. In New York, when I was practicing, I saw hundreds of cases with really amazing success. Then when you get into the disease aspect, this is where it really gets interesting. You know, looking at the modifiable risk factors for diseases like diabetes, high blood pressure, things like that. You know, people come in all the time. I've got a twitch in my lower eyelid, or I've got a migraine, right? Consistent migraines. Those are probably two of the most, short-term modifiable things. Eye twitches, the sympathetic nervous system versus the parasympathetic. You know, your fight or flight versus your rest and digest. The sympathetic is out of whack, and I commonly prescribe a tool that's actually an iPhone-based app that shows them what their heart rate variability is. How high is their sympathetic nervous system revved up, and how can you lower that? So now you're fixing their eye twitch, but you're actually helping them in a sense beyond that. Optimal heart rate variability is similar to achieving a great state of meditation, things like that, and we're really modifying their overall life, making them feel better about different things. Migraines, certain foods, you know, low magnesium, having allergies, things like that are very commonly seen in migraine patients who have a visual aura, and it's very modifiable through diet. Now the biggest ones, diabetes, high blood pressure, those things, and even autoimmune disease, it's really, really interesting to see the science coming out on how these things are changing with diet, with exercise, and some of those things. I'd love to get into some statistics if you like, but why don't we proceed forward? That's really just a segment of it. You know, holistic naturopathic really becomes part when you begin talking about it and sharing your own life experience and and reading the patient and seeing how they are on a friend-to-friend level. How can you help them?
That is excellent. Thank you so much for sharing that with us, Dr. Geller. You went from, sports performance, and eye health to disease to children's health, taking the whole aspects of your entire body, what's going on with your eyes, maybe something else going on with your body. So it's excellent that at your practice, Complete Family Vision Care, you are looking at the whole lifestyle, what is going on with your patients. And
Exactly.
You're right, you don't normally see that with, the regular traditional eye care providers. And so I'm excited that you're bringing that out to San Diego. So do you have any other thoughts you'd like to share with us around nutrition and disease? Did you get them all covered in there?
Sure. I'm looking at my little guide here of things we wanted to talk about today, and it's amazing to see some of the statistics out there. And if I really start with one, it'll be hard to drill down into them all. At the end of the day, we at our practice, we schedule a very long exam time. So typically you have about 20 minutes to 30 minutes pre-testing doing some of the equipment I mentioned, and then you've got about a half hour with the doctor, and that leaves us a lot of time to discuss some of those things. I'd love to tell you about them, some really interesting things, like some of the myths on fat and cholesterol, some of the myths out there about coffee drinking, and how particularly those things can be quite good for you. In another sense, shifting gears away from that, which really will take some time to drill down on some of those statistics, and I do have a blog, CompleteFamilyVisionCare.net. You can read up on some of those. Very interesting to see some of the things coming out, some of the research coming out about retinal cell death, retinal problems, cataracts from screens that you and I are sitting in front of right now. If you look at electromagnetic radiation, right, whether it's a nuclear spill or whether it's light from your computer screen right now, it follows the inverse square law, right? And so basically, inverse sine law. So the closer you are to your screen, which you spend lots of time in front of, the more you're getting this high-intensity electromagnetic radiation, into the ocular tissue. So if you look at the electromagnetic spectrum, UVA, which is damaging from the sun, you put on sunscreen, is right next to blue and violet light, right? And so when you're looking at your Word document, which is white, you have a really high emission of blue and violet light. So we're sitting in front of these all day, and it's really, the advent now, it's happening more and more as, more of the world becomes internet savvy and things like that. You're really looking at retinal problems, cataracts, and other things that research is beginning to show is absolutely, there's a correlation or association there. So we not only look at some of the disease, the modifiable factors there, but the fact that we're all spending so much time on the computer. How do you prescribe the right glasses, the right contact lenses to basically, make sure you're aging healthy, that you're not destroying your eyes from this. You wear sunglasses when you go outside to protect yourself from UV. Perhaps if you're spending 8 hours on the computer every day, a pair of blue wavelength blocking lenses will be something that would be essential. Maybe even big companies should be looking into this as something for their clientele, for their employees. So definitely lots of interesting stuff. I've got a slew of research here, and I pretty much post about monthly on the blog. So a lot of things that I post are out there. A lot of this is public knowledge. I've got a few websites I'd love to show people.
Excellent. Well, I spend lots of time on my computer, and I definitely learned a whole lot myself. I mean, interesting. So I better be watching out for my eyes. I'm staring at these computer screen all day long. So yeah, I feel a little convicted.
That's all right.
My eyes, I didn't think that would happen today. So maybe if you're watching this video, definitely take care of your eyes. And I really appreciate you sharing with us great information. I definitely put the links to your blog below this video, so you can click that link. But Dr. Geller, before we wrap things up, why don't you share how can people get a hold of you, schedule an appointment, or what?
Sure.
How do they do that?
Yeah, absolutely. Well, on Twitter, Matthew Geller OD. Our practice is on. We have our regular website, drericwhite.com. He took that domain name a long time ago, so he kept it. Great guy, by the way. Wonderful doctor. CompleteFamilyVisionCare.net is our blog. A few other ways to reach out to me. Really just Google me. You'll find some of the other interviews or work that I've done and some interesting topics for sure. call the office. 858-278-4720 is our number. Feel free to schedule an appointment with me. We take all sorts of vision insurance and medical insurance, and pretty seamless process to get in the door. Really, you can reach out to me through commenting on the video on YouTube. I'm very active online, and so I'd love to respond in the public domain there. Really just always here for you guys, and I want to stress that a lot of things that you're maybe thinking of modifying in your life in order to achieve some of your long-term goals are absolutely possible. So if you believe in your heart that you can make it happen, you definitely can make it happen, and I'd love to be a resource for you. So yeah, thanks for tuning in for sure.
Excellent. Thank you so much. I put up the website right below this video, and there's a phone
Okay, great.
number.
Thank you.
Yeah, you're welcome. So you can also just click the link right below. And thank you, Dr. Geller, for meeting with me today, doing this interview. And thank you for watching this video out there.
Thank you, Liz.